Hello, everyone. My name's Megan Button, and today I'm presenting my research on the health related factors that correlate with the general health of autistic youth. I worked with Dr. Davis and Mr. Yang during the course of my research, and I would now like to introduce you all to my project. As for my introduction, autism spectrum disorder is classified as a neurological and developmental disability marked by problems with social communication, interaction challenges, and restricted or repetitive behaviors or interests. Persons with ASD may have different ways of learning, moving, or paying attention. In the United States, 1 in 44 children have been diagnosed with ASD, with most receiving their diagnosis after age 4. And while autism affects both boys and girls, it is 4 times more common amongst boys. It is vital that more research is conducted to understand the barriers and facilitators to optimal general health of autistic youth. The objective of my research is to examine the associations of sex, race and ethnicity, insurance status, access to healthcare, metropolitan statistical area status, age of diagnosis, and autism severity on the general health of autistic youth ages 12 to 17. For my methods, we use combined data from the 2016 to 2020 National Survey of Children's Health and applied a multi-cluster survey design in the analysis. The dependent variable is the general health of autistic youth, which is a dichotomous variable that classifies into 2 response categories, 0 being at least good health and 1 being less than good health. Our independent variables consist of sex, race, and ethnicity, insurance status, access to healthcare, age of diagnosis, and autism severity. In our second model, we performed a cross-tabulation of general health outcomes and our independent variables with a Pearson chi-square test. In our third model, we use simple and multiple logistic regression to examine the odds ratios of reporting less than good health being fair or poor, considering demographic variables, age of diagnosis, ASD severity, and access to healthcare based on the weighted population estimates. As for our results, Table 1 describes the demographic information of adolescents with current autism/ASD conditions. As you can see, there's a population account, which is an estimate of where the sample is selected. And then there's a sample count, which is the actual numbers of responses to the survey from the caregivers of autistic youth. We estimate around 800,000 youth who currently have autism around the country based on the sample count of 2,331. Table 2 depicts a cross-tabulation of children with autism/ASD conditions and the general health of autistic youth. The first column represents the row proportions of those with less than good health being classified as poor or fair, and the second column represents those with at least good health being classified as excellent, very good, and good. This table shows females and those with moderate and severe ASD have significantly higher proportions of being in less than good health. The data also reported that Black and Asian non-Hispanic groups might have the same disparity. As we take a closer look, Table 3 depicts the odds ratio of general health outcomes by the demographic variables, ASD severity, age of diagnosis, and access to healthcare. Here we have 2 columns that describe an unadjusted odds ratio and the adjusted odds ratio. While adjusting other variables, females have higher odds of being in less than good health compared to males, and those with moderate and severe ASD have higher odds of having poor or fair health compared to those with mild ASD. In the unadjusted model, the results were similar, but also demonstrated that Black non-Hispanic youth had higher odds of being in poor health compared to the white autistic youth population. While adjusting other demographic variables, females and youth with moderate and severe ASD were more likely to report fair and poor health. For example, females are 3 times more likely to report less than good health than males. Also, youth with moderate ASD are more than 3 times higher, and those with severe ASD are 4 times higher of reporting poor health in comparison to those with mild ASD. Although results were not statistically significant, we are concerned that there may be disparities among autistic youth in the United States based on race and ethnicity, urbanicity, insurance type, age of diagnosis, and access to healthcare. To conclude my research, overall we found that there is a gender disparity which highlights the necessary public health attention among female autistic youth. Moderate and severe ASD are significant barriers to achieving optimal health. We also recommend for future directions to operationalize the classifications of ASD severity, such as the number of comorbidities and the identification of the comorbidities. We recommend that there is a parity in recruitment of male and female autistic children in the future iterations of the National Survey of Children's Health. And lastly, we would like to further investigate whether insurance type and other SES variables associate with the general health in future studies. Please be aware of certain limitations that include the National Survey of Children's Health relies on caregiver self-report responses, which may be subjected to recall bias. The National Survey is a cross-sectional study, so we were unable to identify causality. Due to the small sample size, we were unable to use smaller racial and ethnic groups, such as American Indian / Alaskan Native, non-Hispanic, and other ethnicized groups. And males were overrepresented by over 80% in comparison to females. On the other hand, we do have some strengths, being that the data was already provided by the National Survey of Children's Health, which was free for public use. The survey used a randomized cluster survey strategy to minimize sampling bias. We applied the survey design into our analysis plan, which allowed us to run the population estimate, and we addressed the literature gap in general health among autistic youth in the United States. As I close my presentation, I would like to acknowledge everyone who supported me throughout this journey. Thank you so much to the MCH Learn program and Kennedy Krieger Institute for the research opportunity to bring awareness among the health disparities for autistic youth. Thank you to my research mentors for their support and encouragement, and thank you to the National Survey of Children's Health for providing the data set. Here are my references, and thank you for your time.